Hi, I'm Jeffrey. Welcome back to my channel. In today's video, I will be going over the basics of cognitive behavioral therapy. Cognitive behavioral therapy is a theory in psychotherapy that has been validated by thousands of studies to help people deal with anxiety disorders, mood disorders, substance use disorders, personality disorders, nearly all mental illnesses. At the core of cognitive behavioral therapy, there are 4 factors that we are constantly analyzing. Then we use our best judgment to know when and how to intervene. These 4 factors are the situation, our thoughts, our feelings, and our behavior. Depending on a variety of factors, a therapist will intervene to make a change into one of these 4 factors. Why? Because situations, thoughts, feelings, and behaviors are all interconnected. When one makes a change to one of these, it influences the rest. Here's an example. Let's say that we are feeling tired and we decide to neglect a responsibility. Then we may think, I am so lazy, which then produces a feeling of sadness and more tiredness, and therefore we get stuck in a vicious cycle. Let's say the situation is that we have a lot of different things to get done, and we are feeling tired. Then we decide to neglect a particular responsibility. We then may have the thought, I am so lazy, which then may produce a feeling of sadness and more tiredness, so we can end up stuck in a vicious cycle. Let's say that after analyzing all the factors, one decides that it's best to change the situation. As a result, one may use problem-solving skills to modify that particular situation. To use problem-solving skills, one may ask themselves, have I been able to resolve a similar situation in the past? If so, how did I solve it? One can also ask themselves, if a friend of mine had a problem like this, what advice would I give them? Lastly, one can ask themselves, who is somebody that can teach me how to solve this problem? These are go-to questions that we ask ourselves when we are trying to solve this situation. Now, let's say that one believes that it's best to try to modify their thinking. We may analyze our thoughts, reframe them, respond to them, find evidence against them, or let them go. Thoughts can be classified as automatic thoughts, which spring up from our intermediate and our core beliefs. But that's a topic for another video. To modify our thinking, feel free to check out my other video, How to Deal with Bad Thoughts. Now, let's say that one decides that the best thing that they can do is to modify their behavior. To modify our behavior, we sometimes do something that is called a behavioral experiment. This is where somebody commits to changing their behavior for a specific period of time and see if that changes their mood, their thoughts, or the situation that they're in. Examples of this could be committing for a 1 or a 2 week period to exercising, eating well, doing yoga, or engaging in mastery or pleasure-related activities. Lastly, one can directly work on modifying their feelings. This one is very challenging. Usually, it consists of doing experiential work, such as empty chair work, inner child work, imagery, where one tries to feel the emotion, experience it, and have a release of emotion. This is primarily done in grief work and can also be used in trauma work. This type of work is highly recommended to do with a licensed therapist. In summary, in cognitive behavioral therapy, there are 4 primary factors that we are looking to work on. 1, with the help of their therapist, decides what factor makes the most sense to work on. Then, an intervention is used to modify one of these factors. Then, as we work on that one factor, we hope to create a ripple effect on all the different factors, leading to a more positive cycle. That's it for today's video. If you like this video, make sure to give it a thumbs up, and for more content like this, make sure to subscribe to my channel. Thank you for watching. I'll see you in the next one.